Instagram. My name is Meredith. I'm a patient care coordinator here at Elite Body Sculpture. Today we're in our beautiful Dallas location. We're about to check in on a patient. And Dr. Hans, join us please. Hello, Dr. Hans. How are you?
Good afternoon. Doing wonderful. How are we doing?
We're doing great. Miss Lisa, how are you feeling?
Sleepy.
Well, you look wonderful. Do you mind if I ask Dr. Hans a few questions?
No, go ahead.
Awesome. Dr. Hans, how's everything going today?
Amazing. So doing our Power BBL here at Elite Dallas. Today we did AirSculpt on the full abdomen. And of course, the full abdomen here at Elite is inclusive of upper and lower abdomen, waist, hips, and really what some people would call 360 degrees extending to that posterior trunk. We also did the pubic area and the lower back. So obtained over 9 pounds of fat today. And we're using that to transfer to the buttock, our so-called Power BBL. One of my favorite expressions in plastic surgery, fat is not necessarily a bad thing when it's in all the right places. And of course, taking advantage of that today for Miss Lisa. And what we've done at this point is completed our AirSculpt. And I've actually worked on the right buttock. Hopefully this projects well for you all. What we'll see, we're just looking to round out kind of a hip dip, which is the upper outer portion of the buttock. And then also just give a little pop, kind of a nice round, you know, kind of fun buttock here today. Nothing overly done. When we talk about a BBL, it's often like a haircut. You know, one does not fit all. Some people want a shorter haircut, some people longer, some people like, you know, bangs, no bangs. Same thing with a BBL. It's not that we take this procedure and apply it to all persons. We really want to communicate with our elite patients, understand what they're looking for, and then allow the fat to work for them to complete that goal. So a great procedure here today with Miss Lisa, our Power BBL.
She's looking amazing, as you can see on the one side. We also have the BBL King here, Dr. Hans.
So like I said, I hope this projects. What I've done is put 750 cc's into the right side. We've yet to do anything on the left. And I think this will be a very nice result once we're able to finish up and achieve that symmetry we're looking for. One of the key tenets of the Power BBL is what we call vibration expansion. So we're utilizing that AirSculpt prior to the fat transfer in order to get as much volume as possible for those patients that are really looking for a little bit more in the way of the BBL. And that's a key feature here at Elite Body Sculpture.
Lisa, how did you choose Elite Body Sculpture? What made you decide AirSculpt?
Just because of the recovery time. I'm a nurse and I did not want to have to take like 6 weeks off.
That's an awesome reason to do it. Everything about Elite Body Sculpture, you know, we specialize in fat removal and fat transfers. Our doctors are the best in the business. This is all they do here.
So we're just starting to add a little bit of volume here to the patient's left side. Again, we put 750 cc's and we'll be matching that up. As Lisa pointed out, one of the great things about Elite Body Sculpture and our AirSculpt procedures is the less downtime. And it really is less bleeding, bruising, swelling, inflammation, pain, and of course all those things are going to confer less downtime. I think it's probably the #1 reason patients choose Elite Body Sculpture. I'm often asked, you know, how does it compare to traditional? It really beats it every step of the way, and I think Lisa will experience that today.